Welcome to the Aesthetic Doctor Podcast. We don't shy away and keep secrets here. We empower you with education, telling you the truth about all things aesthetic medicine while encouraging you to be the best version of yourself. It's time to look great and feel good doing it. This is your host, mom, speaker, and board-certified physician, Dr. Borger.
Hello, friends, and welcome to episode 98 of the Aesthetic Doctor Podcast. Today, we are talking about safe lasers and beautiful results with the laser-trained expert dermatologist, Dr. Kesty. Dr. Kesty is a double board-certified dermatologist and laser fellowship-trained cosmetic dermatologist. She is the co-founder of St. Petersburg Skin and Laser, one of Florida's largest physician-led laser centers, where she performs advanced cosmetic and medical laser procedures with over 35 devices. Dr. Kesty also founded Kesty Laser and Esthetics Institute, which is a training program led by her that is meant to equip providers with the knowledge and skills to confidently incorporate lasers into their practice. Dr. Kesty has extensively published in dermatology and laser research, and she hosts her own podcast highlighting innovation in aesthetics. Dr. Kesty is dedicated to elevating the standard of care in cosmetic dermatology with her passion for education, patient safety, and practice growth. I am so excited to have Dr. Kesty join me today as we talk all about lasers and laser safety. Welcome, Dr. Kesty. Well, Dr. Kesty, I'm so excited that you're here today.
Thank you so much for having me.
So you are like a super duper expert. I always bring in experts, but you're like next level expert. You're a fellowship trained cosmetic and laser surgeon, like I said in my intro. And will you just tell our listeners exactly like how much training and what kind of training it actually takes to get to that level?
So yeah, thank you so much for having me. My name is Kat Kesty. I practice in St. Petersburg, Florida. And the training that I've done is I did 4 years of undergraduate training, and then I did a 5-year combined MD and MBA program. And then I did a 1-year internship where we do general medicine. And then I did 3 years of dermatology residency. And then I did a 1-year fellowship in Manhattan where all I did was lasers and cosmetic procedures.
Yeah, so as I said, super expert. Anyway, what inspired you to get into the field of dermatology, but really laser dermatology?
So that's a good question. And when I was in an undergrad at Wake Forest, I studied during my summers, and then during the year, I got a research fellowship to do a paid research fellowship on theoretical chemical physics, which is basically studying the smallest little molecules that we have, called chiral molecules, so kind of down to the atoms, studying how they interact with each other. So I spent my summers during college studying this theoretical chemical physics. I thought about doing a PhD, even though I had always wanted to be a doctor since I was a little girl. I thought about kind of switching gears and doing a PhD. And then I decided to go to medical school because I love people. I love interacting with people, learning about them. And so I went to medical school, kind of stumbled upon dermatology during my MBA, actually, because my mentor at the time was also going into dermatology. And then I also did a day with a laser surgeon during my dermatology residency. And I said, this is exactly what I'm meant to do, because it's very physics heavy. There's a lot of physics and math with doing lasers all day, every day. And I love doing research on lasers. I publish a lot of papers on lasers and cosmetics. Even though I'm in private practice, I'm not affiliated with academic institutions. I still love to publish. And I love the people. I love my patients. I love the long-term relationships that I get to have with patients. It's such an honor and a privilege to be a physician, I think, in the United States, and especially in dermatology and lasers. Like, there isn't a day that goes by where I'm not grateful and thankful for every patient that walks in my door and trusts me and my team and my staff with their face. So I love it. It's like the perfect thing for me. It's just the best job in the whole world. So
Yeah, I love that. And you know what? I'm going to just share an aside. I actually spent my summers doing analytical chemistry and studying photoluminescence and like wavelength absorption of light. So here we are. I never linked it back until you just said that. And I was like, oh, wow. Okay. So we are all predestined. So when we really talk about lasers, what are some of the myths about lasers that we could maybe share with like our end user listener that we can sort of maybe debunk so everybody can learn a little from this episode?
I would say the two biggest myths that I hear from patients about lasers is number one, that in the darker skin tones, so Fitzpatrick 4, 5, 6, you can't do lasers. I'm not sure where this myth came from, but I can do any procedure on patients with skin type 4, 5, 6, acne scars, treating active acne, resurfacing, wrinkles, eye rejuvenation. All of that is available to all skin types if you have the right laser in the right setting. So that's a big myth that I wish that more people kind of understood, because I think people suffer with acne scars or other conditions that lasers can reverse and help treat, but they just don't know, or maybe they've been misinformed that they aren't right for their skin type, which is not right. So that's a massive myth that I hear. The second myth is with downtime in lasers. I think a lot of people look on social media and they see these recovery from lasers where it's 2 weeks and they look like a fire extinguisher blew up in your face. And they think that's really the only way. And it is a way. You can do deep resurfacing. You can do these procedures that make you look like you've had a laser or a burn for a week or 2 weeks. And those are great procedures. But we also have a lot of options that are either no downtime or minimal downtime for patients to still get them those results. So that's a big myth too, is that every laser you have this massive amount of downtime, and that just isn't the case. If you have a bunch of lasers in your practice, you can really give patients the full spectrum of options. From we can do one ablative laser and you're going to look 10, 15, 20 years younger, or we can do 6 to 12 no downtime lasers and still get you a really great cosmetic result, still kind of target the wrinkles or acne or red veins, whatever we're targeting, with no downtime. So there's lots of options in terms of lasers for patients. So
I love that you kind of segmented me actually into the next thing that I wanted to talk about. You mentioned Fitzpatrick 4, 5, and 6, which again, people, I do have a episode on the Fitzpatrick scale because we use it a lot, especially in lasers and laser physics. It basically has to do with the amount of melanin your skin has. And so for really lay people, it really has to do with how dark your skin is. Fitzpatrick 4, we're thinking like South American origin. And then when we talk of 5, and I'm generalizing, I would throw out the example of somebody who's maybe of Indian descent. And then when we talk about 6 is African American. So just for our listeners, but I think especially as your skin is darker, and it's one of the things I really promote on this podcast over and over again, with most aesthetic or all aesthetic procedure, and especially laser, like training matters, your provider matters so much. And like Dr. Kesty said, there is beautiful options for all skin types, but then not all settings, not all lasers, not all devices are safe for all skin types, especially in the wrong hands. And I would argue that especially as your skin type gets darker, you are at a higher risk for side effects, for dyspigmentation, for burns. So please, please, please seek out somebody who has super good training. And yeah, what do you want to say about that?
So my kind of I have 3 things for patients to look at. And if you want really great results, and if you want to minimize your risk down as much as you can, do these 3 things and you won't ever have a problem with lasers. One of them is look at their credentials. So obviously, how much training have they had, formal and informal. I think both of those are interesting things to look at for patients. Number 2 is look at their before and afters. You should see their own before and afters, not the laser companies, not their partners. You want to see the before and afters of your provider that you're going to see, and you want to see if you're Fitzpatrick 6 and you have acne scars, you want to see Fitzpatrick 6 with acne scars in their before and afters. So look at their before and afters. They should have a wide breadth. And then my third thing, which is something that I came up with based on research that me and my assistant did last year, was call the office and ask them, how much time does that person spend doing lasers? Because in all areas of medicine, the more time that the provider spends doing that procedure, the better they are. And that's been shown for everything from orthopedic surgeons to pathologists. It's common sense, right? The more you do it, the better you are. And same with lasers. So I always encourage patients, call the office, ask the staff, because the staff should know. If someone calls my office and says, how much time does Dr. Kesty spend doing lasers? Depending on the day, it's going to be anywhere from 50 to 100% of the time that I spend doing lasers. I like that 50% mark for patients. I think if you spend 50% of your clinical time doing lasers, after a couple of years, you're going to be very, very good at lasers. If you're spending 20 hours a week just doing laser cases, after a couple of years, you're going to get a pretty high volume and you're going to understand the mechanics of lasers. Those are my three things: credentials, before and afters, call and ask the staff what percentage of time that provider does lasers. And I think you're going to find someone. So.
And then what I always say too is don't be afraid to ask the provider question, because any of us who especially really know what we're doing, like I am able to answer your questions, and B, I'm happy to answer your questions.
For sure, yeah. Yeah, I mean, that
So-
cosmetic consult should be a very educational thing. And sometimes I'll even tell patients, this is a lot of information for a consult. We'll write it all down, come back, reconsult. If you have any questions, like please call me, text me, especially with something like lasers. If someone's never gotten lasers, even if they have experience in injectables, filler, Botox, it's a lot of information that you're kind of absorbing from that person at the cosmetic consult. So definitely as a patient, write your questions down, answer them, and get a feel for that provider if they're willing to answer your questions, all the way from high level questions all the way down to, like, I've had patients that are engineers that come and are like, why do you like 1064 versus 532? Like, tell me the exact reason, as if I'm a laser fellowship trained dermatologist. And I'm like, okay, let's do it. Let's get into it. Don't get me started about lasers, because I'll talk all day about the exact nuances of every laser, because I love it. It's my kind of passion and my job, obviously. So yeah, I love it when patients ask me questions. I never get offended. I'm like, please do your research and ask me any questions you have, because that's the buck stops with you as the provider, right? You have to be the expert, and the patient has to build that trust with you, which a big way to build that is just to answer all the questions and enjoy doing it.
Laser safety is obviously a really important topic in aesthetic medicine, in aesthetic practices. So, what are some of the most common mistakes you see maybe less skilled practitioners making?
I would say the wrong laser and the wrong setting, for sure. I think we get into a big problem when people only have one laser, so every patient gets that laser. And I think a lot of it is just a lack of education that's unbiased. Like, your podcast is great, kind of unbiased education. And doing what I do kind of on the other side, having seen like a lot of what I call revision cases in my practice, where people come to me with burns and issues, there isn't a week that goes by where I don't have a couple revision cases, and then doctors calling me on the side, asking me for help with this or that patient. So I see a lot of those cases. And I think it's just education for providers. Unfortunately, this is just the world that we live in. So that's kind of what inspired me to start educating others, kind of formally and informally. I have some residents that come with me and they'll watch me do laser cases. So that's a great education thing for me. And then obviously more formal, kind of starting the Laser Institute, because we are not biased. I don't work for any of the laser companies. They don't pay me. I don't get paid. I don't work for CeraVe. No one pays me anything. The only people that pay me are my patients and other providers that pay me for my honest, unbiased opinion. And I think that's kind of what I'm hoping to do, is just to educate people about lasers, so that when they go and pick up whatever laser they choose is right for their patients, they have confidence, they have skills, they know this is the right laser for their patient and their practice is my goal.
And I love that you're doing that. I mean, I have looked over the curriculum of your course, and I think it's actually a course that people should take before they get into lasers. So I think, again, if you have a laser and you need help, it's still a great course. But I think it's really a course that they should take before they get into laser. And, having been in the industry for a while and having a very successful med spa, I get lots of people reaching out to me and they're always like, should I buy this laser or that laser? And I'm like, whoa, 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 whoa. You're like literally asking me, should you buy a dump truck or a lawnmower? These are not anywhere close to the same thing. They do very different things. You have very different target population. You have different delegatability. And it does a lot of times. I will sit down with a lot of practitioners and I'll be like, okay, so first of all, like, what does your population consist of? What does your population want? Are you going to be doing the laser? Do you want to delegate it? What is it that you're trying to offer? And tease those things out. But it is like, I think, so important that people have this understanding. So when they make their first purchase, and first of all, it's a very expensive purchase and lasers can do incredible things, but they can also cause harm. They like know what the device does, what its parameters are, and sort of the science behind it. I think that's the thing that when I've gone and taught a couple workshops, mainly on IPLs and radio frequency microneedling, and it really sometimes blows my mind. Just again, because there's not a lot of great places to get, I think, this unbiased, good baseline information so that you understand wavelengths, you understand patient selection, you understand what ablative versus non-ablative is and why you might want to choose one over the other.
Mm-hmm. Yeah, I completely agree with you. I mean, even when I was starting my practice 5 years ago, I just finished my laser fellowship in New York and we had about 100, 150 different lasers. So I had tested essentially every laser on the market. And so even when I went to go buy the lasers for my practice here in St. Petersburg, the laser reps come in and they're doing their job. They're selling you the lasers, but there was no one I could call and say, look, you've tested every laser, you've demoed every laser. I think I've demoed even all the new lasers now. What do you think is best for me? That I just want my people who take my course and, that join the Institute, that come to our in-person courses, to do the best that they can. And ultimately it's all about the patient. Like I started the course for the providers, but it's all about providing great laser care for the patient. That's kind of my ultimate goal. Obviously, being a physician, it's all about the patients. So yeah, I completely agree with you. And that's kind of what drove us to start this course, which, I completely agree with you on the point that when people step into the laser market, they don't get that broad overview of here's all the lasers so that you understand if you choose this 1064 or 532 or IPL laser, here's how it fits into this beautiful rainbow of lasers. And they don't get that broad view of the laser world because we just don't have that resource, or we didn't before this course that I could find. So thank you so much for saying that. I appreciate that.
Well, seeing that we're already on the institute and the course, why don't you formally tell us, because we do have a lot of practitioners listening, what is the course about? What is it for? And what can participants expect to gain from it?
Thank you so much for giving me the time to do this to your audience. I appreciate that. The first course that we launched is basically a broad overview of all the lasers on the market. So we're going to be teaching you about all of the different wavelengths, all of the different devices that are on the market, and to help you have an understanding of all the lasers that are out there so you can choose one that fits your practice and your practice style. And you understand when you're talking to patients, hey, this is a radiofrequency microneedling device. It is not going to give you a 20-year rejuvenation, or this is a fully ablative erbium. It's going to give you a 20-year rejuvenation, but there's going to be 7 days downtime. So especially when you're starting out, or even if you have a device, maybe people need a little bit of education about how it fits into the world of lasers so that ultimately they can educate their patient and decide, this is a great laser for you or my patient population, or maybe this other one I could add to kind of get the full spectrum of laser care for patients. So it's a great course. We've had patients and laser reps take it, but yeah, it's mostly geared towards people who are either new to the world of lasers or have some experience, but just kind of want to step back, get a completely unbiased formal education on the lasers. And we made it fun. There's lots of clinical pearls from our kind of years and years and years of practice that we throw in there for if you're a more experienced provider, or if you're new to it, you have a good set. Included some information about how we do consults, how we take pictures, tons and tons of small little clinical pearls, tips and tricks with using lasers, integrating them into your practice. We have a lot of before and afters that we explain exactly how we went from the before and the after in lasers. So people after the course have a really good idea of all the toolkit of the different lasers.
And the one thing I wanted to mention too is that it's asynchronous. So you've recorded the course. So if somebody already has a practice, or maybe even they're like thinking about transitioning in aesthetics and they still have a daytime job, like they can do it on their own time. They don't have to be available at 2 p.m. every Tuesday, correct?
For sure, yeah. And in terms of the investment, there's not a week that goes by where you probably get this call too, where someone's like, "Hey, I bought this laser. I don't know how to use it. Will you buy it from me? I'm stuck
Oh,
with these
all the
payments." And I'm
time.
like, I
All
wish you would have just taken my course before, you know. It's a little bit of investment, obviously, but before that $150,000 investment, invest in just a teeny bit of education, just to make sure that it is the right laser for you and your practice before you make that massive financial investment in a laser.
I couldn't agree more. And again, it's even if it can only prevent one bad outcome, it's worth based on the amount of headache you have, the worry you will have, the potential lawsuit that you have. But you're absolutely right. Lots of, I mean, I get the same thing. I get inundated with people reaching out to me and they have bought 2, 3, 4 lasers at some. Oh, this is another thing I would love to mention. I don't think anybody should ever get trained on their device they buy by a laser rep.
Yeah.
So if you buy a device from a company, they should send you a clinical trainer to train you. It should never be the rep, because reps are not the same as practitioners. And the same, every company will host these clinical symposiums, but they're really sales meetings.
Right.
So that is really, and while you can learn great things about their particular device, again, it does not substitute the education you can get from up to date, like conference like ASLAM's, the American Society for Laser Medicine, a textbook, or a course like yours. It's mainly a sales presentation with a little bit of clinical background thrown in.
Yeah, for sure. For sure.
So I just wanted to say that as an aside, because I think a lot of people are relying on this to get their information and they think it's non-biased, and it absolutely is.
Yeah, and I think people don't see ROIs on their investments as well because of this problem. They do a day of training with, even if someone comes to their office, but you really need that hands-on training of someone watching you, which is why we have some exciting things planned for the rest of this year in 2026, where we'll have weekends kind of here at my clinic or at some various other places where we'll actually get people that have already taken the course, and that we'll do more courses on, for example, Cyton lasers, and we'll just have a weekend where all we do is BBL, or all we do is resurfacing, or all we do is eye rejuvenation, which is a super specialty that we do here in my practice. So we'll be teaching people kind of hands-on. Again, our goal is just to get the best outcomes for patients, and then for providers, it follows. So
I think that's awesome. And it's probably based on some of the gaps you've seen in laser treatment for professionals, I assume.
Oh yeah, I mean, you need someone that does lasers all day, every day to teach you how to do lasers. That's just how it is. And a couple years into our practice, we were like, we're seeing so many complications. Like, we got to do something about this. We have to get people trained on lasers. We have to offer them a place where they can go and get hands-on training from experts. And then also a place where they can go if they need help choosing a laser and if they're just kind of delving into the world of lasers. So it's something that's really important to us because we're seeing a lot of complications from lasers, and there's nowhere to go to get good laser training, unfortunately, right now, kind of fill that gap. So we're trying, we're doing our best.
I love that. I mean, I totally love talking to experts. I love talking to entrepreneurs, because most of us, the reason we build courses, we build institutes, we build retreats, we build things, a lot of it has to do that. It's really what we would have wanted. Let's be real. I
Yeah.
feel like every time like I build a retreat, I mean, yes, there's also lots of feedback I've gotten from prior retreats, but the bottom line is I would love to go do this. Or 10 years ago, I wish this was here, right? Or
Yeah.
my friend went through this and like we figured out there was nothing like that. I mean, let's
Mhm.
be real, it's something that touches us personally that we get to witness, and then we kind of go and do something about it.
Yeah.
So what do you love most about teaching others about aesthetic lasers?
I like the excitement that people get, especially with lasers. Lasers are so cool. They're like using light energy to change people's faces, change people's skin. So I love when I have other physicians here in the office or other providers, and it kind of like clicks for them, like, oh, I can do this. I can use this laser, and we'll help them with everything from like hand placement to settings to physics to everything. And kind of seeing them, especially the first patient's always rough, right? When you pick up a laser and you are doing a first patient, even if it's something simple, it always takes 45. I tell my staff, like, if it's someone's first laser, 45 minutes to an hour just for a face. It's a slow, it looks easy, but it's very, very difficult with the facial contours. And until you have a laser in your hand and you're doing that, I don't think you understand how difficult it is. Because you just watch, people will watch me for a couple days and they're like, oh, schedule me 10 minutes for the face. I'm like, no, 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 I've
Like
done this before. Like,
an hour and a half, like later they're
yeah.
still doing the neck on the radio frequency microneedling, and they're like, well, I'm not getting the insertions.
Yeah, so it's just, and then, the second patient, it's 30 minutes, the third patient, it's 15 minutes. Depending on their level of training, they can kind of ramp up really fast. So I just love when they're like, oh my gosh, this is so cool. It's getting easier. I love it. Like, I could definitely go out and do this on patients. So it's really fun. I love learning myself. I'm constantly kind of keeping up with the literature and contributing to it now. Grateful for that as well. So I love teaching. I love teaching dermatology residents and then other providers that come into our practice. It's so much fun to teach them about something that I love so much. I love lasers. I love talking about the physics. I love talking about the patient side of it too, because a lot of lasers, patients have no idea what a laser is, and they're putting a lot of trust in you. And there's a lot of education that goes into that. I get to kind of educate patients and educate providers. So I love it. It's so
That's
cool.
awesome. You know, you're contributing to research, you contribute to science. Like, where do you see the future of lasers and aesthetics going?
I think that combination laser treatments are going to be much more available. I think lasers in general, it's kind of like wildfire right now. I mean, patients, especially with social media and podcasts like this where we're talking about it, patients are like, wait, I've been getting Botox for like 30 years, but I really just want better skin quality. Like, sign me up for lasers. I think we're seeing that kind of go crazy right now, especially in the US. I mean, I'm based in the US, but in Canada as well. And I think that we need to get providers we need to get enough providers out there that are doing lasers to a place where patients love their skin. So I think we're going to see just a massive increase in volume in lasers in general, and then more and more providers entering this market as they see that patients are coming and asking for it. In terms of kind of the laser technology itself, we've had some ups and downs recently with lasers in terms of we thought things were going to do really well and maybe they don't have as good of effects. Maybe we're seeing maybe more complications than we want with some of the newer technologies, which I won't mention here because I don't want to be negative. But so we've seen some upsets in the market recently with some things that have come out and maybe promised more than they could deliver. So I'm seeing this kind of going back to kind of our traditional old school resurfacing because those are tried and true. They work so well. Patients love them. So I think we're starting to see kind of it kind of cool off a little bit and just going back to basics. Like, let's go back to laser physics. Let's go back to kind of what works. Not that we're not tweaking settings along the way and kind of the patient experience, and then combination lasers is a massive thing right now. How can we combine lasers for the best outcome for patients? So that's what I would say. I'd say, our tried and true technologies are making a comeback. More patients are entering this market every day. We just don't have enough providers to keep up. We need to be training people on lasers. And then one thing that I think that is not talked about at all, I've actually never talked about this formally, is using lasers to treat skin cancer. I think that's a massive thing in the market right now. More and more data is coming out. I'm actually working on a review paper with some dermatology residents right now, so that hopefully will be out in the next couple of months. I think that's going to change how patients think about skin cancer. I think it's going to change how we treat skin cancer. We're talking about skin cancer more from a preventative standpoint, especially for our Fitzpatrick 1, 2, 3. I think that 5, 6 years from now, will we be doing Mohs surgery for those small little basal cells and squamous cells? We'll have to see what the data shows, but
I love that, and I can't wait to read your paper because I know there's already a couple that have come out talking about specific technologies about how with fractional lasers and then down the road, like population studies of comparing skin cancer rates. And the other thing is, I think that we're going to combine a lot is try to combine really the energy-based technologies with some of the biostimulators. At least like when I was at Aslam, it seems like that's what everybody was trying to figure out, what the magic sauces of throwing them together. What do you think about that?
Yeah, I love the biostimulators. Sculptra, Radius are kind of our tried and true ones. And then some of the newer technology that's on the market, PRP, stem cells, all of this is kind of in a renaissance right now. So we'll kind of see how everything shakes out. I know the FDA has come out on some stances with some of the products. We'll see, in stem cells are kind of a huge thing internationally, not as much in the US yet. So I'm excited. I use a lot of dilute radius with my laser patients. I love it. I love it more than Sculptra just because I feel like I get better results. But I know some of my other laser colleagues love Sculptra. Let's see how the data shakes out. Let's see what the FDA does. But yeah, I mean, anything to build more collagen for patients to get better results, because that's really what it is. I'm like a maniac about results for patients. Anything that I can do to get them better results with less downtime, with less pain, with less recovery, to help them both from a cosmetic standpoint and a medical standpoint, I'm all over.
Yeah, I know you do lasers all day long. And so I asked pretty much every practitioner, like, what is their favorite treatment to get and receive? But I'm going to throw an extra one. Who's your favorite child? Which one is your absolute, like, if I was to take every single laser from your practice and leave you one, which one would you be?
That's easy. I'd probably choose 2940. So your erbium lasers. So, it's such a customizable laser because you have the ablation, but you also have the coag, so you can add heat for tightening. It's one of my favorite lasers for eye rejuvenation, for jowls and lower face rejuvenation. You just get amazing results using different combinations of settings. It can do brown spots. It can reverse aging of the DNA. It's amazing. So I would definitely say erbium, hands down, my favorite.
Okay, well, she has no problem picking her favorite child. Okay. And do you have a favorite treatment? So is that also your favorite treatment to perform then, an erbium laser?
I like anything around the eye would be my favorite treatment. I think the eye area is just such a delicate area, and you really have to know what you're doing around the eyes. We put metal contacts in, we use some tetracaine drops, we use cysteine, we use Lido with epi. So there's a lot of things that go into rejuvenating around the eye. Obviously safety-wise for patients, then also to get great results. Sometimes I'll combine erbium with CO2. Everything is such a customizable thing for the patient around the eyes too, depending on age, what their goals are, what their downtime is. So I love anything around the eyes just because it's such a great outcome for patients. And it's something that not a lot of people will put metal contacts in and go into the eye and do resurfacing. So I love those cases because the patient's always happy. And what's interesting, it's intellectually stimulating because you're always customizing it for the patient. So those are always my favorite patients. Yeah.
Do you have a favorite laser treatment to get on your own skin?
So my sister does my laser and I let her be the doctor. So I just tell her what downtime, but she usually does she's done a couple eye rejuvenations on me. And then I'm obviously pretty fair and grew up in Florida, so I have a lot of sun damage. So we do a lot of treatments on me to reverse some of the sun damage. And then I switched over to using PRP for my skincare. So every couple months, my staff will draw my blood, spin it down, put it in a serum. So I started using that as my skincare, which was like a treatment because it is that PRP skincare, which I love. So that in combination with some lasers has really helped me.
Well, for those of you who are watching on YouTube, you have, I'm sure, looked at her flawless skin the entire time we've been talking. For those of you who are listening in your car, like Dr. Kesty's skin is like that. No makeup, flawless glass skin that you all want. Well, thank you so much. I would love for you to tell our listeners a couple of sort of things. First of all, what is the name of your laser institute? How can people find the course? How can they find you? And you host a podcast as well. Now, for those of you who are driving, we put everything in the show notes. So wait until you got where you're going and look at the show notes.
The name of the course is Kesty Laser Esthetics Institute. And our in-person courses are held for now in St. Petersburg, Florida at my practice called St. Petersburg Skin and Laser. And you can find me on Instagram. It's just my name, Kat Kesty MD, and my practice, St.
Okay.
Petersburg Skin and Laser.
Cat with a K, Kesty with a
Yeah.
K.
Yeah, if you just Google my last name, Kesty, pretty much everything will come up because it's an unusual Norwegian last name.
Well, that's awesome. Do you have any final words of advice or encouragement for our listeners?
Thank you so much for having me, and all your listeners, thank you so much for listening. If you have any questions, feel free to send me a message on Instagram. I check those myself. Thank you so
Awesome.
much
Well,
for listening.
thank you again for coming on. It was such a pleasure to talk to you, and make sure to check out your stuff. And especially if you're a medical provider, I cannot stress laser safety enough. I feel like you're going to next have to do a course for patients. If they're like, which laser is right for me? I feel like that is the next thing you need to do, as a lower course lower cost kind of course that is the which laser is right for me. Because then also, like you said, I live in a place that I call a dermatology desert.
Yeah.
And it really is a dermatology desert, right? So people in Florida and St. Petersburg are incredibly lucky to have you. And there's big parts of the country, and we're in the East Coast that's well populated, but I can't even imagine what it's like when you're somewhere in rural Missouri. I think it's really important for patients to also educate themselves to make sure, and that's really why we're doing this as well, is so that both providers and patients get really top information. So again, thank you so much for being on it. It was such a pleasure to talk to you.
Yeah, thank you so much. Have a great day.
Thank you for listening to the Aesthetic Doctor podcast with Dr. Judith Borger. We'd love to connect with you outside of the show. Follow Dr. Borger on Instagram at Dr. Borger, and find more online and ways to work with Dr. Borger at www.theaestheticdoctor.com. Until next time, be well.